So here you are watching drug-induced sleep endoscopy with BIS monitoring in a 50-year-old male, known case of obstructive sleep apnea on CPAP. His AHI is 65, which is very severe sleep apnea, and his body mass index is 28, so he's slightly overweight. Now you can see a concha bullosa on the right side, you can see the turbinate hypertrophy on the right, you can see a deviated septum to the left, which is gross. Now as we see inside, there are no adenoids. The salpingopharyngeal folds are grade 0 by Agrawal's classification, less than 25%. And you can see a complete collapse of the soft palate. Clinically also a soft palate is pretty long. You can see a complete collapse of the soft palate. Right now the BIS is only 80, is in 80s. I am waiting for the BIS to go below 80s. He's got a small chin, retrognathia, but you can see in spite of the small chin, his tongue is not really very large. There is no lymphoid tissue of the tongue. Epiglottis is not collapsing. He is already snoring, but his tongue is not collapsing. It's majorly a collapse of the soft palate, both AP as well as lateral, which is the cause of his obstructive sleep apnea. So our aim is to first perform a nose surgery so that he can use his CPAP more effectively. Then if he is not willing to use CPAP, then a palatal surgery, modified uvulopalatopharyngoplasty with suspension bridge can be offered to him. I'm still waiting for the BIS to come below 80 at least. You can see a complete collapse of the soft palate. Pretty long soft palate. Now the BIS is in the 70s and you can see him completely obstructing. But even then, now he's already in his early 70s. So at this time we can see a little bit of collapse of the tongue also, but still it is not a complete collapse. It's majorly a collapse of the soft palate. So this is the correct stage of assessment. His sleep apnea is majorly because of his soft palate collapse. The tongue base collapse is not complete. If I close his mouth completely, now I'm closing his mouth completely and I'm trying to assess. The soft palate is still collapsing completely. Base tongue is not completely collapsing in spite of the small chin. So what you see from outside may not be the case from inside. Right? This is a soft palate collapse. Now his saturation is going to 85. His BIS is in the 70s. Is the absolutely the correct range. So at this stage, we are first performing the nose surgery. And as I said, he'll be able to use his CPAP more effectively. And if he does not want to use CPAP or is not compliant, then in the second stage, we might offer him a palatal surgery, uvulopalatopharyngoplasty modified with suspension bridge. All right. Thank you for watching.